Hello, and welcome to the CDO Magazine interview series. This is going to be a very exciting discussion. I am Lana Feng with Huma.Ai. Today, I have the pleasure of talking with Anders, who is the Chief Digital and Information Officer at Novo Nordisk. Welcome.
Thank you very much. Happy to be here.
GenAI is moving so quickly, right? The innovation is almost like every day there's a new large language model that solves a particular problem, right? And so as a large, leading global pharma, how do you stay innovative?
I mean, it's a combination. I mean, you're fully right. I mean, this field is moving extremely fast, and I think many companies were a little bit surprised of the Gen AI a year ago when it entered the market and how quickly it was making its in route into the market. So, of course, we've been working with AI and machine learning for many years. We already had skilled people, but without any doubt, we have accelerated our journey on that. Meaning, of course, we need to scout for talents that knows this. We need to upskill our workforce to be savvy in AI, Gen AI, and typically you need a combination. I mean, you need a scientific sort of understanding, you need a Gen AI understanding, and you need to combine that, or you need to combine it with market understanding and Gen AI. So it's a combination of recruiting new talents, upskilling our internal workforce. But of course, as you say, we also need to partner with the various companies. There's no way a pharma company can keep all the knowledge and competences in a field like Gen AI. So of course, we're working also with anyone from the big tech companies to niche companies and forming various sort of partnerships or just buying the software perhaps. So that's also part of the strategy, of course, to be part of an external ecosystem of knowledge in this field.
Great. So I want to kind of maybe double click on that a little bit, right? So some of our audience are going to be kind of startups, right? And then so kind of maybe in your take, right, from Novo Nordisk standpoint, like, or your experience, right, working with like the giant tech giants like Microsoft versus a startup, right? So what is the difference in terms of what your advice to the audience who are startups out there, including my company, right? So in order to be successful working with a global pharma like Novo, what we need to know or what we need to do, like, in order to ensure a successful collaboration.
I mean, I think in many cases it's about having a very sharp focus, clear idea what part of the value chain you will help us improve somehow. And then, of course, approaching that part of the organization. I mean, for sure, when we speak about broad impact in the knowledge workers, I mean, it's typically the Microsofts and Amazons and whatnot in the world addressing that. But when we're coming to maybe a drug discovery phase or a marketing phase, it's about zooming in on particular sort of problems and providing a very, very well-defined solution. And then we are, of course, more than happy to engage. And of course, we also understand that engaging with Microsoft, Amazon is not the same as a smaller startup company. So we also put mechanism in place where we have a dedicated part of our organization that is skilled to engage with startups, driving innovation together, doing in a joint way. And we have a classical sort of funnel mechanism where we can start small and take ideas and then step by step mature them, hopefully to something where we can go full scale or in worst case abort somewhere in between.
Thank you for the advice. So I want to kind of circle back to the use cases, right? You have this many use cases throughout the entire value chain, right? And you're the CDIO. So if your CEO comes and say, okay, which use case would give me value in the next 6 to 12 months? Right. So there's a Gen AI, there's a timeline attached to innovation, which is exciting and scary at the same time.
I mean, it's a good and relevant question, and of course, I'm getting that one way or another. And I think it depends to some degree on what phase your company are in, where you need to focus. Novo Nordisk is in a good spot for the moment. There is a very high demand of our core products, particularly in the obesity space. So you can say, in a way, we have a higher demand than we can supply for the moment, meaning that maybe looking for increasing demand is not our key focus. So if I would employ Gen AI, it would not necessarily be first priority in the commercial sort of space. It would be more in the drug discovery phase to make sure that we also can innovate for the benefit of the patients for the future. So we concentrate a lot our efforts into the research and development phase to make sure we can bring new innovative medicines to the market in the future as well. So that would be one thing. That's never a sort of a quick fix, because that's a long, lengthy sort of process. But the return is obviously high when you're succeeding. When the second portion where I would deploy my effort would be to support the office workers, the knowledge workers with Gen AI tuning, and we see a tremendous uptake in interest when we do that. And it's maybe too early to qualify and verify the full benefit, but we see very, very tangible examples where people using the modern Gen AI tooling from different sort of vendors to really drive efficiency in the daily work.
That's good. I just read this news article, I think last night, was that office workers are secretly using Gen AI to like aid their work for companies who
Okay.
like abandoned. Yes.
Yeah.
It's very interesting.
Yeah. No, and I think it's obvious that a lot of people quickly see the benefit. They quickly see the benefit for them in the daily work, and they are quick in adopting new technologies.
Even maybe helping their kids do homework, right?
Could be exactly.
So I want to move on to our next segment of the sort of the discussion, right? Is about what do you see kind of the challenges, right? In terms of the, touching on responsible AI, maybe you see how the industry can kind of overcome those challenges.
I mean, clearly there are limitations. I mean, you need to be mindful about how you apply it, because it's a little bit of a black box sort of approach. It can easily be trained in a biased sort of manner, and we have a social ethical responsibility to handle that in a careful manner. But also on top of that, legislation is coming in place, and at least in Europe, there is an AI legislation act coming in place with clear rules and regulations, but also clear fines if we're breaking those. So for sure, we need to be mindful on when and where we deploy it, and be sure that we understand the limitations as well.
Great. So I want to kind of maybe drill down a little deeper on the
Uh-huh.
sort of particularly the hallucination piece, right? Because I think
Hmm.
it's relevant for anyone deploying LLMs for Gen AI. And that's also we kind of try to tackle to remove those hallucinations by introducing human expert in the loop and what have you. I'd love to kind of hear your take on, hallucination is intrinsic to large language models, right? How do you see our industry, healthcare life sciences, where accuracy is important to kind of how to address this?
Hmm. So, I mean, we're still in an early phase of deploying this, and we have decided on a tiered sort of approach. So we understand that before we put it in very, very touchy sort of use cases, we need to learn and experiment. So we're going to start in areas where the data quality is well understood and well known, and where the output is less sensitive we're not going to use it for things that are impacting patients sort of day one. So we basically have decided on use cases that are less sensitive from an output sort of perspective, and where the data is well understood and well known. So and by that we're learning how this is working in reality. We're putting together groups that monitor this, that have an ethical and quality sort of dimension to it, and then we basically plan to expand it into more and more advanced use cases over time, and we will let also time flow according to what is needed to fully master this. So we really are keen on avoiding anything that could be ethically wrong or provide a wrong biased hallucination sort of type of situation. So step by step, we're going to expand the envelope where we're going to be able to use AI in our industry.
That's a great approach. And you brought up a really great question, right, about the European regulatory body trying to putting regulation for Gen AI. And with the innovation moving so quickly, how do you see it really putting in regulation to make sure we deploy Gen AI responsibly, but then in the meantime, not stifling innovation?
Well, in a way, I do welcome authorities putting legislation in place. I think we, as a company, has a social responsibility. I think we are used to having a good and open and honest dialogue with the different sort of authorities and legislative bodies in different sort of countries. So it's a healthy type of dialogue. We do respect that they are the legislative part. I think they normally also respect that we have understanding and knowledge of our sort of industry. So I think that sort of healthy collaboration, maybe a wrong word, but that healthy sort of dialogue in between authorities and industry is good. And when the legislation is there, of course, we take utmost care to follow and adhere to that. But I think it's a sort of a bit of an interplay that normally happens, and where we both play different roles in the making of those coming in place.
Great. Thank you so much, Anders Romare, CDIO of Novo Nordisk, for joining me today. That was a fantastic discussion on an exciting topic. Please visit cdomagazine.tech for additional interviews.
Thank you very much, Lana. It was a pleasure.